The usual check, can you see her in your frame, guys? Okay, thank you. Thanks for that. I think everybody's here. Kelsey, are we good?
Yeah.
I mean, we're like a minute early. Can I start or you want me to wait?
Let's wait 1 minute.
Okay.
Just to be safe.
Absolutely.
Let's get the meat up for you.
Okay. We're good? Okay. All right. Once again, thank you for being here. Really appreciate you taking time to be here and learn more about what's going on in our community with COVID-19. I do have some sad news to share today. We've had our first death in Knox County from complications of COVID-19. This person was hospitalized and was in a high-risk group for complications. We are heartbroken for this family and share our deepest condolences with them. Unfortunately, we know from this pandemic that this won't be our only loss. We expect to have more cases as we are still in the initial phase of this outbreak locally. We expect our case numbers and people who lose their lives from this virus to continue to rise. Regarding the situation in Knox County, our current case count is 57. Hospitalizations are 8. Again, this is at any time during their illness, people have been hospitalized. And recovered is 17. It takes time to see the results of our social distancing efforts, especially with a 14-day incubation period. However, data and history both have taught us that what we're doing as a community is an effective way to slow down, not stop, the rate of infection. We continue to expand our response as the outbreak grows. Our teams are continuing to reach out to those who have tested positive to share information on how to protect themselves, their families, and those around them. We'll continue to conduct contact tracing and monitoring, and we continue to work daily with healthcare partners to expand testing. We are also working closely with a variety of local partners who have been working diligently to support our community. Earlier this month, we reached out to the Knox County Emergency Management Agency, KEMA, and asked them to activate the Emergency Operations Center, EOC, to facilitate a team who could focus on the social and economic impacts of COVID-19. This allows the health department, along with our entire healthcare community, to better focus on slowing the spread of disease. KEMA, the City of Knoxville, Knox County, social service agencies, nonprofit organizations, and many others have come together through the EOC and are coordinating an exceptional response. Normally, when activated, the EOC would be filled with first responders and other emergency service providers. But KEMA and these partner organizations have managed to launch this innovative approach, and all in a virtual model. And for that, we are really grateful. They're really doing a lot of work to help serve and help support those who are struggling financially or with housing or other social needs. Speaking of social needs, we understand the impact of this is having on families, individuals, and businesses. We know the Chamber, the Knoxville Chamber and the state have many resources listed on their websites, including how to get unemployment benefits, small business loans, and employment resources. We encourage folks to look to those websites for support regarding finances and work. Those who need help with housing, food insecurity, even employment and other issues should call 211, another really great resource in our community that is providing information for folks in need. These challenging times are difficult for all of us and our mental health, and it's crucial that we continue to support one another, check on each other, and share the existing resources for those who may be struggling. In addition to the ones we've already outlined, an excellent mental health resource is the 24/7 crisis text line. Anyone can text the letters T-N to 741-741 to be connected with help. Again, that's texting TN to 741-741 for help. I also encourage people to step away from COVID-19 information as you can. It's very important to stay informed and up to date, but it's also important to take a break. Watch a good movie, read a book, go for a walk. Find a way to take a break from this if you can, as you can, with your family, with your friends. And remember, you have the power to protect yourself by following guidelines on social distancing and hygiene. So now I'll open it up for questions.
Dr. Buchanan, is there anything else you can share about the person who passed, when they passed, their age group, gender? We've seen some other health departments give that kind of information.
Sure. So we'll say they passed this weekend. Oh, sorry. Thank you. The question is there any more information to share about the person who passed? I will say they passed away this weekend. With our small number of cases and only one death, out of respect for the family and the person who passed, we are not releasing any more information at this time. We anticipate as that changes, we will release more information, as you've seen other health departments do, with information about deaths as well as cases. So we anticipate doing that in the future, but just with an isolated case, it seems appropriate to protect privacy and personal stuff. So.
Dr. B, the mayor this morning said he hopes to have businesses open hopefully before the April 30th date that President Trump gave this weekend. Can you speak to that date and what your thoughts on as the, I guess the safer home order does, it's supposed to end next week, next Tuesday, of course that could be extended. Can you just speak
Certainly.
to that timeline?
I think what we'll do locally, and we agree, sorry, the question was, can I speak to the statement that the mayor made this morning about hoping to have businesses open before the end of the month, and what the safer at home order and how we'll make a decision about that order. We certainly agree with the mayor and using local data to make local decisions. Things happen at the local level, and they're not the same across the state, and certainly not the same across the country. And we will, with the mayor, make that decision, make the best public health decision for our community based on the situation at the time. I don't have a way to predict what that's going to be, but we will use data to make that decision and make any recommendations for furthering or canceling that order.
Sure. And follow up to that, and this may go to you, maybe the mayor. I've heard other maybe folks in the mayor's office reference special powers is the wrong word, but special emergency time powers that are given to the health department. Are you aware of that, or is there a pecking order with these decisions where you can overrule an entity because you're the health professional in this situation?
Under public health law, not even just under the emergency order, under public health law, I do have the authority as the health officer to close businesses, stop activity that puts the public at risk for an infectious disease or other event. We always make those decisions in concert with our leadership. We make recommendations based on the public health information and data. We have a really good relationship with our leaders, and we serve as the public health expert to help guide in making those decisions.
And is that a state provision that you referenced, or is that?
Sure. So the question is about public health law and what authorities the public health officer has. Under the emergency declaration, there are some authorities, but they're pretty much the same as the ones I have during regular times, and that's under Tennessee Code annotated, under the control of infectious diseases.
Dr. Buchanan, I wanted to follow up on something we talked about on Friday, and that was an anomalous spike in suicides last week. It's now 3 days later. Has that trend continued? Has it abated? What do we know about that now?
The question was about the spike in suicides last week. Has that continued, or has that abated? I'll have to be honest, I have not had a conversation with the medical examiner's office, so don't have that information off the top of my head at this time.
So talking about contact tracing, you said that your office is still trying to do that even though we have 57 cases now. What does that process look like now since there are so many?
So the question is about contact tracing, and what does that process look like now that we have 50 plus cases? What that means is that we're working 7 days a week to do contact tracing. We have activated our continuity of operations plan, and what that allows me to do is reduce some things that we would normally do and pull those staff members into helping with this response. So we've mobilized folks who don't normally work in communicable and environmental diseases to help us do those things. help with checking on cases. That's being done by a non-medical person. That's just checking to make sure they're doing okay in their home. If there are any questions, that could be sent to somebody else who can answer those questions. So mobilizing my staff. The mayor has also agreed to allow us to mobilize some county staff who are not actively working at this time to help us with the phone bank or answering phone calls. The city also has offered to extend staff as well, and we will mobilize those staff as we need to. So it looks like getting everybody on board and adding to the people that are making phone calls so that we can successfully reach out to those folks.
And has your department seen any hotspots since there is community spread? Is there any areas in the county that a lot of the patients have been?
Right, so the question is, have we seen any hotspots? Right now, we only have 57 cases, and we haven't done any mapping with that information, but anecdotally, we don't see any recurrent areas that we're seeing, like an isolated outbreak within a community or maybe in a long-term care facility. We have not seen that.
Was the person who passed away, did they contract it for community spread, or were they more at-risk groups?
Well, so the question is, the person who contracted it, did they contract it through community spread, or were they one of the more at-risk groups? So a little clarification. Being in an at-risk group means you're at risk for complications, not for getting the virus. So those are different things. We're all at risk for getting the virus, which is why we want all of us to practice social distancing. So that person was in a high-risk population for complications, and I'm looking at Charity. I believe it was a community-acquired case. I believe so, yes.
Dr. Buchanan, kind of bouncing off some of how I mentioned, we are about a week into the Safer at Home order. What's your perspective on how well it's been working, anecdotally in the community or through some of the statistics that you guys have been seeing?
So there are two ways to look at that. So the question is, how well is the Safer at Home order working? And again, I would think there are two ways to look at that. How are people observing the Safer at Home order and following those recommendations? I think that varies. I think I know that my staff has been working with restaurants and other businesses to help them understand the order better and be able to be in compliance. And I will say anecdotally, complaints from the public have reduced, so we're seeing fewer complaints. So hopefully that education is working and people are getting in compliance. As far as its impact on the spread of illness, that's going to take a while for us to see. When we have an outbreak in a facility where we can intervene and have them stop visitation and do that kind of stuff in other situations, we actually generally want to see a couple of incubation periods with no new cases before we say, let's relax and leave it alone. So it takes a little while. This disease has a 14-day incubation period, so we all need to continue doing these things, and it's going to take some time for us to see the impact on illness rates. We'll know the rate is flattening and going down when it starts to flatten and go down.
Speaking of social distancing, we've seen a lot of people still complain about the parks, whether that be city, county, any park. They're seeing a lot of people there. What would you advise those people who still want to go out and about, but they're all gathering at the parks right now?
So the question is about city and county parks, people gathering at the parks and maybe not observing social distancing. I would just go back to, empowering everyone to make that decision to take their health in their own hands and observe social distancing no matter where they are. It's not, to be 6 feet apart isn't what we're used to, so it takes some thought. You have to think about it. How far apart am I? That's about the length of an average dog leash, if you want to use that for measurement. And to observe those, even if you're at the park, they don't go away. They don't go away if at home or at the park or at work. They're still in place and they're still important. And again, I would also say, if you're sick, don't go to the park. Just because it's outside doesn't mean it's safe and that you can't make someone else sick. So all of those guidelines and rules apply. Washing your hands regularly, using hand sanitizer when you don't have soap and water. Those things still apply even if you're in a park. Honestly, again, I really go back. So the question is there going to be a warning if everybody doesn't listen, we're going to close the parks? I really would rather take the partnership approach to this asking our community, asking our residents to be in partnership with us as we try to reduce illness in our community and take those measures on their own, and cooperate and follow those guidelines that are clearly stated in lots of different places.
I have some questions about if you do contract COVID-19. For the people who have even mild symptoms, how can they be more comfortable at home dealing with it?
So I'm going to ask some clarification. So the question is about, is the question about people relieving their symptoms and tolerating being at home? Okay, thank you. So the question is about how can people who have COVID-19 relieve their symptoms? So the symptoms of COVID-19, fever, cough, maybe shortness of breath, body aches, fatigue, all of those symptoms. So like many other viruses, there's no pill to give you to make you feel better. So what people can do is use whatever over-the-counter medications that is okay for them to use, that are okay for them to use. And they should know that based on their medications and based on their personal history. So ibuprofen or Tylenol, cough medicines, things to relieve the cough, relieve the body aches, maybe help you sleep a little bit better. And drinking plenty of fluids and getting plenty of sleep are really important. So staying home and resting and taking care of yourself, some self-nurturing is really important in recovery from this illness.
Do you have any food recommendations that they should be eating?
Question is, do I have any food recommendations that they should be eating? Honestly, I don't have any food recommendations. We always recommend that people eat a healthy diet. So if your appetite's decreased, you might just have to eat the things that you can tolerate eating, depending on how you feel. Eat foods that you like, that are healthy. But continue to eat is important. Fluids are also really important. When we say drink plenty of fluids, meaning non-caffeinated, non-alcoholic fluids.
Dr. Buchanan, I've got a couple of stat questions real quick. You said there were 8 hospitalized back, can't remember what the number was on the website. On the website, when you look at that as a number of hospitalized, that is people who've been hospitalized since this began.
Yes, anybody with a diagnosis of COVID. So the question is, when you look at the number of hospitalized, what does that represent?
Right.
Go ahead.
The follow-up
Mhm.
then is how many are currently hospitalized? Do you have that?
I actually don't have that number. So yes, so the number that's posted on our website is the number of people that are hospitalized who were diagnosed with COVID-19 at any time during their illness.
And the other question I had was we had 16 new cases added today. The number of tests remained the same at 600.
The number of negatives, is that, okay.
The number of overall tests.
Yeah, that's what.
Okay. So the question is, we had more cases, but the number of tests remained the same. So what we know happened over the weekend is that there was a lag in reporting negative tests. And so what we got were the positives, which are the ones we need to get so that we can follow up on those folks and put them in isolation and educate their family and those at risk. Tennessee Department of Health is working on getting us the data on the negatives. But again, the negatives aren't as important to us in managing this outbreak and reducing illness as are the positives, because the positives are the ones that we take action on.
Dr. B, a couple other stat-based questions that you've been asked a couple times, so I'll just keep asking. The first is kind of a two-part. Do you know how many open hospital beds the county has, and then how many ventilators the county currently has?
That is data that's collected do I know how many hospital beds and how many ventilators the county has? That is data that's collected by our hospital resource tracking system. And that information is held very closely and tightly by folks at the state level. And when needed, my staff can see that. It's very limited who can look at that data. And the purpose of that is to make sure that we share fairly with those in need and that we can direct care to the appropriate place.
Lastly, and you mentioned this last week, and you were asked about it last week a couple times, but update on whether there'll be drive-through testing in the county.
The question is, will there be drive-through testing in the county? And my answer is the same. We continue to work with partners to make that happen and to make that available for the citizens of Knox County. One of our challenges is getting the supplies needed to make that happen, the personal protective equipment as well as the supplies to collect the specimens. So I have a team working diligently on doing that, and we hope soon we will be able to offer that to the citizens of Knox County It will be for those who screen and have an indication for testing. And so it won't be just for anybody who comes in. There'll be a process for approval of screening to be tested.
Can you give us an update on medical supplies and PPE in the county?
The question was, can I give an update on medical supplies and PPE in the county? We received some supplies from what's called the Strategic National Stockpile. That was given out to our area providers, hospitals, to help with their needs. And then, individual, doctors' offices or other places have, and long-term care facilities have supplies of personal protective equipment that we have no way of tracking because they have their own inventory system that's not shared with us. So what we know is that we got some supplies from the Strategic National Stockpile. We've distributed those to the appropriate people that need it. I also know that we're collecting stuff at the National Guard Armory to be incorporated into the state response. So other efforts are going on. To be incorporated in the local response.
We're working on a local way.
Okay, thank you. We're also working, sorry about that. We're also working on a local way to do that. So there are a lot of moving parts with that. And again, there's private supply out there that we have no way of tracking.
Dr. the Gallatin response, the response to the Gallatin Healthcare Center group that over the weekend was state, local, surrounding counties, very highly coordinated, multi-jurisdictional response. Are there similar plans in place in Knox County for a, God forbid, similar outbreak in a nursing home or assisted living facility here?
So the question is, are there similar plans in place in Knox County if we were to have a nursing home or long-term care facility outbreak like they had in Middle Tennessee to bring all those resources to bear? And the short answer is yes. We're on calls at least twice a week with the State Department of Health and other partners. We work daily with the regional health office trying to coordinate contact tracing. As you can imagine, people don't observe county lines and they're in and out of the counties and have friends that live here and there. So we work with them daily. Part of our response is to bring all of those resources to bear when needed. And so yes, we would have access to those resources if we need them here in Knox County.
Has there been a confirmed case in a nursing home in Knox County?
Honestly, I don't have that information on the top of my head, to be honest. So not that I'm aware. I mean, Charity. Okay. So we have had a case in an assisted living in Knox County. So the question is, has there been a case in a long-term care facility? There has been a case in an assisted living. And we follow the protocols that we follow anytime they have a case of the flu or they have a case of a GI illness. They have infection control plans. They've implemented those. We're working with them to make sure they keep those in place for at least 14 days to reduce risk of infection. We're also working with them to get folks who are at risk tested as soon as possible.